Hi everyone, for those who may not know me, my name is Sofia Garcia and I will be presenting the therapeutic use of animals. So first off, I'm going to start off with the introduction. Pets and animals have been an integral part of the American society, and the strength of using animals in a therapy has shown the feelings that are often a positive reaction by using animals in a therapeutic and the wide range of the benefits. In this chapter, the effects of the therapeutic use of animals has been shown the sense of social development and increasing emotions in individuals. The definition of therapeutic use of animals involves the interactions between animals and humans to help achieve their therapeutic goals. In the book, the terminology used to describe the program that fuses the animals into a therapeutic program, such as using many TR specialists to help train the animals to achieve a specific outcome. The use of animals to assist the people into achieving the therapeutic goals has occurred into the variety of settings, such as nursing homes, therapeutic farms, and residential psychotic treatment facilities. And with the diverse range of population, such as individuals with depression, autism, aphasia, social limitation, post-traumatic stress disorder, cerebral palsy, intellectual disability, and dementia. Animals have been used to assist with development of empathy and positive social behaviors. The phases that have helped describe the concept of the therapeutic use of animals include animal-assisted therapy, animal-assisted activities, resident animals, companion animals, service animals, and factual therapy. So now we're going to talk about the definition of the RT facilitation technique. So we have the animal-assisted therapy, also known as AAT, which is a goal-directed intervention in which the animal meets a specific criteria and is a part of an integral of the treatment process that is directed and delivered by a health or human service professional, with help with specialization experts within the scope of the professional practice. Then we have the animal-assisted activity, also known as AAA, which are the activities that include with the interaction with an animal that provides an opportunity to increase motivations, learning, and resulting leisure at therapeutic outcomes that enhance a person's quality in life. With AAA, the triage specialist is providing an opportunity for the participants and the animals to help to get to know one another. These interactions do not have predetermined therapeutic goals or documentation to demonstrate the process that is not required. Next, we have, which is resident animals, which typically lives in a human service facility full-time and is used to boost morals of the residents. The care for the resident animals is provided by a variety of individual staff, which includes volunteers, residents, or staff. Even though these animals are owned by the staff members or agency representative. Next, we have the companion animals, which is often used to the phase referred to in literature in conjunction in the word therapeutic. The household pets, such as dogs, cats, or birds, are considered companion animals. Although owning a pet or having an animal as a companion in many ways therapeutic in terms of improving health or happiness. Also used as companion animals are not typically used to achieve as a therapeutic outcome. Next, we have the use of service animals, which myself, who is hard of hearing, has a service animal. For the people with disabilities that also present in a literature use of animals, in a treatment or non-treatment setting. So using such as phases of seeing eye dogs, hearing ear dogs, assist dog, service dog, canine helpers, or guide dogs have been reported to help increase the independence and quality of life with individuals with disability. So for example, what I had was known as a hearing dog, which will help me with my hearing disability. So that would help a lot. And last we will be using is the functional therapy. So animals are used as the conjunction with functional therapy to improve the therapy and client relationship by fostering trust and sense of unconditional acceptance. These animals are used as a dialogue starter when conducting group discussion and acting to calm participants. Now we are going to talk about the history of facilitation technique. The belief that the animal positively influence on people has a long history, and the strength of the animal-human bond have been recognized for thousands of years. Animal has provided the means of transportation, protection, power, and companionship. Throughout history, the popularity of companion animals among society has been recorded. The first documentation use of animals in the therapeutic setting was in Bengal. In the 9th century, the evidence is that the therapeutic use of animals was in the late 1700s in England at York Retreat. The institution has founded by the Society of Friends. William Turk encouraged people to receiving psychotic services to the care of animals to help increase their self-control. This involved with them being that with the unconditionally provided affection. An important fact of the treatment involving these farm animals was that the animals became independent of the people. The use of animal in therapeutic manners occur in Bethel, Germany, at the treatment center for people who are diagnosed with epilepsy, founded in 1867. The AAT, also known as the animal-assisted therapy, used in the Bethel is similar to the therapy provided in York Retreat. Bethel's therapeutic use of animals program included farm animals and park housing wild games. The first documented evidence of the therapeutic use of animals in the United States occurred during World War II in Poly, New York, at the Army Arms Corps Conversation Hospital. According to McCollum, in 1983, the AAT consists of working at the hospital with farms, with hogs, cattle, horses, and chickens. If the participant is so desired, they can interact with the woodland animals such as snakes, frogs, and turtles. Levinson believed in the connection between humans and animals. He argued that the use of animals companions encouraged mutual support and led to social and emotional adjustments. Although they had therapeutic effects for the lives of humans for years, it was not until 1960s and 1970s that the therapeutic use of animals began to be researched. So the examples of the history of the ritual therapy facilitation technique, for example, in ancient Egyptian reserved dogs, believing nothing to exceed the fertility of the dogs, and the worship of cats, often mourning for months upon their death, and subsequently mummifying the cat's body. Another example is that Levison first observed a benefit of the AAT with children quite by accident. Levison's dog, Jingle, was presented when a mother and her son had entered his office in an early for a child appointment. Levison observed the interaction between the child and Jiggles, and felt Jiggles assisted him to the rehabilitation of the son. One of the case studies that has been given to me in the book is known for Olivia. Olivia lived in a suburban community of a large city. She was 74 years old and was recently a widow when her husband of 43 years died after an onset of sudden illness. Olivia has 2 adult children who lives in the other city. Olivia and her husband shared a home that she can no longer care for alone. Olivia has arthritis in her hands, knees, and shoulders. After several months of living her home alone and discussing the various residence options with her children, Olivia decided to move into assisted living facility. It was a difficult decision, and she was sad to leave her home. But in addition, Olivia was not permitted to live with her 10-year-old cat, Mindy. Fortunately, Olivia's daughter has provided her a home for Mindy. When the moving day arrived, Olivia considered that she was alone. She was leaving a home she had shared with her husband, and felt she was losing her independence and had given up her cat. Although the move was uneventful, Olivia had a difficult time adjusting to the facility. Olivia had the sense that her new life was extremely scheduled, and the way she achieved a sensible of life before move was to stay in her apartment among her familiar belongings. Olivia noticed that there was a program involving a therapeutic use of animals called Animal and You. When the activity room, Olivia met some other volunteers and their animals. Seeing a golden retriever reminded Olivia of her pet childhood, and has shared the stories with the dog handler about how much her dog had enjoyed swimming with her family during the summer vacation. Other residents said too had a retriever who enjoyed chasing ducks and swimming in the pond. She and Olivia laughed about the respective dogs and treats. The section ended, the volunteers and the animals left. Volunteers telling residents that they plan to visit them again in a couple of weeks. Olivia was experiencing social withdrawal after moving into an assisted living facility. The Animal and You program involved with the therapeutic use of animals gave the TR specialist an opportunity to promote Olivia's interest in social activities. Olivia enjoyed the contact with the animals through the petting and grooming that reminisces with the volunteers and the other residents about the pets that she has owned through her life. In addition, Olivia met other residents and subsequently became more involved with the activities in the assisted living facility.
The description and purpose of the therapeutic use of animals. The therapeutic use of animals to assist people with goals has come up in many different settings, such as nursing homes, therapeutic farms, and residential psychiatric treatment facilities. Such settings have a variety of populations like those who have depression, autism, aphasia, social limitations, post-traumatic stress disorder, cerebral palsy, intellectual disabilities, and dementia. In these areas, animals are used to help with the formation of empathy and positive social behaviors. One of the biggest volunteer organizations and most well known for providing a range of assisted animal therapy, or AAT, is called Pet Partners. Pet Partners is an international organization that serves to educate people and encourage human-animal relations. People who are adamant about helping people with illness or disabilities can train animals to become service or therapy animals and improve the overall wellness of people. One way animals can improve wellness is by giving the person independence by being a companion animal. Animals are used for therapy in many other ways, but the most frequently used is contact with animals. This contact with animals usually comprises of having the animals be petted by the patients, such as when talking about traumatic experience or when stress arises. Another intervention is caring for animals, which some programs offer as a treatment that promotes nurturance. A good example of this is an inmate program with training shelter animals. The last intervention to mention would be animals that are used in psychotherapy. Together with psychotherapy, animals are used to greatly improve the client-therapist relationship involving trust and acceptance. The animal can aid with starting conversation and can help soothe the client in times of anxiety. Petting an animal, such as a dog, while talking to the therapist can significantly lower nerves when starting a one-on-one or group session. So an example would be someone recalling a bad memory, and while they say the story, they can pet the animal when stress comes in, or a dog's breed being the beginning of a dialogue for a group session. Now, theoretical foundations. Theoretical foundations are a way of saying or explaining the reasons or understandings of how the therapeutic use of animals could benefit people. One theory that is discussed is the human-animal bond theory. This theory comes from the basic idea that people seek animals for comfort and companionship. Since bonds between pets and people affect both physical and mental health, it is good to use the natural bond that exists for therapy. Different aspects of the bond or relationship, such as caring for and touching the animal, has shown positive results in animal therapy. This human-animal bond can be found documented in history, but only recently has this been explored in research. Those who study the therapeutic use of animals show a psychoanalytic orientation or an unconscious process of conflicts as the root behavior when discussing how animals influence people. These studies then mention that humans could be attracted to interacting with animals without conscious thoughts put into it. The theory that people have this innate attraction to being close with animals is becoming more accepted. The attraction can lie with the animal's unconditional love and loyalty, which can be considered therapeutic. This is noted in instances where people who have an illness or a disability interact and spend time with animals, then begin to feel better in their lives emotionally, mentally, and physically. The other theory that is important to know regarding the foundations is prolonged exposure. This theory initially came after the treatment of a group who had PTSD after experiencing sexual assault. It is common for people being treated for PTSD to do a type of prolonged exposure that will make the person remember that event. At first, this would not seem like a good treatment because it applies stress, anxiety, and fear in the PTSD patients. However, with continued treatment, the person progresses and it eventually reduces the PTSD effects. This theoretical model, designed by a man called Lefkowitz and his colleagues, requires the patient to have prolonged exposure and to tolerate more stress with animal-assisted therapy. So the way it works is there are at least 5 sessions with the animals and therapist. Before each session, the patient is usually assessed to determine if they would be willing to work with an animal during therapy. Such things as allergies or fears of animals will be discussed. If the client agrees to it, the animal will be introduced in the first session, and they will get to know the animal and how it'll be involved in the session. The next meeting, there will usually be a debriefing about the first session, and then the person's PTSD triggers will be talked about. If the client starts to have anxiety when this is being talked about, they're encouraged to play with or pet the animal as they talk more in depth about that trauma. They're encouraged to use the animal as a comfort and confidant when retelling the trauma over again. So eventually, it causes no anxiety when it's recalled. This helps separate the actual event and the memory of the event, since PTSD causes physiological stress when past trauma is remembered. Having an animal to help with this has not yet been researched thoroughly, and there should always be caution when planning and thinking of implementing this model in a therapy session. Like assisted animal therapy, assisted animal activities differ because the animals are more used to a comfort role rather than a treatment role. So, in an activity, there doesn't necessarily need to be any set goals other than to relax the person. The effectiveness of these activities on pain, fatigue, emotional distress can be examined in one example of 133 adults with fibromyalgia. So, this group was given the option to join a study with animal-assisted activities, where dogs would be in a waiting room, or they can choose to reside in the traditional waiting room that contain mostly magazines and TVs. There were pre and post surveys done that asked about pain, fatigue, stress, sadness, calmness, and irritability. The experimental group rated a high level of satisfaction. However, there is always caution advised again when using this method, since the amount of time spent with the dog varied from person to person, and the overall waiting room experience did not have a big impact. Another study involving fish aquariums with 62 adults who have Alzheimer's disease. There were positive results with the assisted animal activity, as it concluded an increase in overall nutritional intake and weight. The participants in this study were observed in their existing groups in the facility where they stayed. In this case, there were 8 brightly colored fish that were placed in tanks and positioned to light up. This was to facilitate interaction and observation for residents with visual impairments. For the control group, a picture of the ocean was displayed. All the participants' weight and intake were measured before the study with no major differences across groups. Although in all groups, men ate significantly more food than women. For the control group, there was no major difference before and after the study. The groups that had fish tanks installed showed a statistical increase for food intake and weight. Some elements or factors that could be related to these findings are from the individuals who wandered and walked would be more inclined to sit down, which led to more time eating. Also, people who were idle show more attention to the fish tanks, which led to more food intake also. Though this study has shown that people who have dementia and Alzheimer's can gain weight and have food intake without the requirement of any drugs, there are still problems with the study, such as a lack of information regarding the etiology of dementia, animal preferences, food likes or dislikes, and the ability to eat independently. Aside from those 2 physical outcome examples, a study done regarding quality of life saw an intervention of an 8-week assisted animal therapy activity. It would be roughly twice a week for 20 minutes. Participants were tasked with caring for and playing with a guinea pig. These participants were required to hold, feed, clean, groom the animals. The study was done to test the social functioning of children with autism spectrum disorder. Parents and teachers completed 2 different rating systems and found there were no changes from the study initiation to a week before the intervention. However, only 1 week in, parents and teachers noticed a change in social skills and social behaviors. There was also a decrease with social withdrawal behaviors. This study gives people a glimpse into the possibility of assisted animal activities for children with autism spectrum disorder.
Hi, my name is Sarah, and in this video we're going to be talking about the therapeutic use of animals. In this case, we're using my dog Daisy. Some of the most common animals for therapy are dogs, cats, and rabbits. Daisy is a mixed dog. She's about 9 years old. So for therapy, older dogs are usually recommended because they're calmer, you can trust their actions, that they won't lash out. So what we're doing now is just petting Daisy. This would be used as an assisted animal activity. Just petting her like this. It'll calm you, relax you. There's no end goal really, it's just to feel relaxed. In a therapy session, maybe you might have a goal like petting Daisy whenever you feel stressed. So now I'm going to show some clips of Daisy and my other dog Rose. Here we go.
Petting a dog is an intervention called contact with animals, which is a way animals can be used in therapy. Petting dogs can be therapeutic and help health-wise by lowering blood pressure, reducing the stress hormone cortisol, and aid people who have anxiety and depression. Here you'll see some videos of a stress-relieving activity, playing with pets and watching them play together. Taking a break from a stressful environment such as school or work to play with your pet can have healing benefits. It can let you clear your mind before returning to these stressful events. For someone who has a brain injury, for example, playing with their pet could mean practicing hand grasping or throwing motions. Please take a moment to de-stress and watch my pets play. This next activity involves walking our dogs. Walking your dog is a great way to bond with your pet. The physical activity combined with the human-animal bonding is a double stress reliever. Some dogs might be a challenge to walk, but training and walking is a great activity to learn more about an animal. Take a walk with us and enjoy.
For the activity for the facilitation, we are required to spend the use of what the therapeutic use of animals is shown. So, for example, the equipment needed for when I played with my animals was the dogs, collars, leashes, toys, and treats, as well as a positive mindset that considers that it's medically equipped by the ADA. The environment needed is a calm, positive mindset, as well as an open environment. Therapeutic benefits, which is the purpose of the pet therapy, is to help someone recover from a cope with health problems or mental disorder. Which is such as help with improved fine motor skills, improved balance, increases focus and attention, increased self-esteem and ability to care for oneself, reduces anxiety, grief, and isolation. Also, it can help reduce blood pressure, depression, and the risk of heart attacks or stroke. The leadership style that I realized that it was more of an authoritative style, which is you have to understand that you are in charge of the animals and they need to know that you are the owner and that you interact with them and that they know between the positive mindset and a negative mindset. And last is the adoption use, which is structural, psychological, and behavior adoption.